All right, so I want to talk real quick about CPR. There's no substitute for an official course, and I highly recommend you take one, whether it's American Red Cross or what have you. Definitely go take one of those. But I'm gonna run you through the down and dirty basics of how to perform CPR. I'm gonna preface this too with the fact that the rules and regs and the way you perform CPR does in fact change about every couple of years or so, whether it's this many compressions or this many breaths, something like that. So make sure to stay current and stay on top of the most recent American Red Cross suggestions. Number one, you're gonna wanna make sure that that patient, that person isn't just taking a nap on the beach, right? So you're gonna check their level of consciousness. Are they breathing? Things like that. Once you identify, yes, I do have to perform CPR, make sure you can get EMS on the way. Okay, yeah, this is an emergency situation. Hey, you go call 911, calm yourself, whatever the situation may dictate. And then you're gonna get into compressions, right? You go straight into compressions. The way you're gonna do that is interlock your fingers. You go central on the sternum, just below the nipple line there. You kind of use the butt of your hand. And what I would recommend is locking your elbows. And the reason for that is because you're gonna go so fast and rapid and deep, you're gonna go about 2 inches deep, that it'll get tiring really quickly. If you lock your elbows and just use your torso to move, that'll get you going a lot longer. So, with that being said, you're gonna compress, again, about 2 inches deep on an adult, and you're gonna go for 30 seconds. Now, how fast do you go? It's about 100 to 120 compressions per minute. If you need help with that, think of the old Bee Gees song, Staying Alive, right? I like that one because it's kind of a pun with the name of the song, but there are literally entire playlists on Spotify for CPR songs that you can go. So 100 to 120 per minute, you're gonna do that for 30 seconds. After that 30 seconds, you're gonna go ahead and tilt the head, kind of pull the chin down, right? That's the head tilt chin lift. You're gonna wanna pinch the nose, breathe in, and as you're breathing in, make sure they're actually taking in that air. So what you can do is look down. Is that patient's chest rising and falling? If it is, you're good. If it's not, you can readjust up here. Maybe the connection isn't that good here. Of course, if you have a CPR mask, even better. But again, these are the down and dirty basics on how to do CPR. So remember, it's 30 seconds of compressions, 2 breaths. Continue that until EMS comes. They're gonna take over. You can pass on any pertinent information, but this will get you by in that emergency situation if you haven't taken an official CPR course. All right, stay safe, guys.